Have you noticed the blackest discoloration in your body? Then you should watch this video till the end. If you are suffering with the blackest discoloration on your body parts, then it is acanthosis nigricans. What is acanthosis nigricans and why it is been affecting me? Then this video is for you. The blackest discoloration on the body folds or the skin folds is called as acanthosis nigricans. Okay, what is acanthosis nigricans? Hyperpigmentation in the neck or armpits or underarms and body folds, even in the knees, even in the breast region, even in the groin region, even in the eyelids. Everywhere you can see the hyperpigmentation. What is hyperpigmentation? Is the blackest discoloration of the skin. Okay, the other skin will be looking like normal, but some part of the skin will be looking very darkish because of that. And some people think that it is because of the dirt, or it is because of their sweating and the dirt is being accumulated over there, and because of that their skin is looking like that, and they try to wash it off. Of course it's not going to go away, because it's a sign from your internal body to your external body that internal body is been suffering and it's asking for an help, and you should always look for that. Okay, first we'll be knowing what is acanthosis nigricans and why it has been causing you. It is because you have high insulin or you are insulin resistant. Okay, 70% people of this whole world is suffering with this acanthosis nigricans, and some know about it and some does not know about it, and they just leave it like that, or some think that it is just kind of, it is because of skin or some kind of dirt like that. And if you ask who are more kind of into this acanthosis nigricans, men or women, if you ask me, it is the men. And sometimes this darkest discoloration of the skin comes with the skin tag also, and you can see age group between 40 years. And why it is been happening to me? Because the internal body is saying that you're suffering with this kind of disease. It may be diabetes mellitus, it may be PCOS, it may be increased metabolic diseases, it may be hypothyroidism, it may be increased cortisol levels, means stress hormone levels, or it is because of obesity, or it is because of sedentary lifestyle, or it is because of hypertension, or it is because of lower HDL levels, hyper, or it may be because of hyperglycemia. Anything it may be, because we does not know what is the cause, because every different person is different in this universe. So we should look for what is your kind of thing. Okay, why the insulin is too much in my blood? Because I eat what it should be eaten. I'm not eating more, or I'm not kind of doing this, that and everything. No, eating proper meal is very important. Eating unbalanced diet is also very important. Okay, first we'll come to know about what things you're doing wrong. What is insulin resistance? Eat too many of carbs, because you're not taking the veggies, or you're not taking any kind of salads, you're not taking any kind of probiotics, you're only taking the carbs, which leads into the increased blood sugar rise, and it also increase into the more insulin release. Because of that, the fatigueness comes and more fat storage happens, and because of that you always feel like you are hungry and you are not full. Okay, what you can do for this? Increased insulin in the body, which means increased cells, which make the skin look thicker and appear darker, because if the body is been releasing too much of cells, where it is going to go and store? Of course it's going to go and store on the skin only. So you're going to notice that extra skin which is of darker color. and why and how you can really kind of correct it. By correcting your obesity, by correcting your hypertension, by correcting your insulin levels, everything. What you should be doing to do that? Change your lifestyle, because you are the only person whom you can depend on. Before you depend on medication, you can say, you're a doctor, you can just prescribe me some medicines, why I should change my lifestyle. No. Before medicines, of course medicines help, but you can cure it internally by yourself. Just go for that, because curing naturally is very important. Change your lifestyle means change your routine, how you are living your life. Just sit down and ask for yourself that is it the correct way, and avoid taking high carbs, high calories. And if you're into the sedentary lifestyle, like you're not doing any physical activity, after eating you're just sleeping, or you're not going out in the sun, you're not taking any kind of physical work, and you're only doing the mental work, and you're crying like that, don't do that kind of thing. And cut down your high carbs and high fats. Okay, what you should do, what if you ask for what investigation I should be doing if I have to know that I am suffering with this? You can do the blood sugar levels, blood insulin level, and OMA IR. These are the 3 investigations which you can do to check your insulin level. Then, what is the treatment or the management part? Some people use the basin, baking soda, or scrubbing, everything. Of course, it's not going to help you, because the cause is internal, not external. So if you does not treat it internally, what is the use of taking it off externally? So don't do that. Okay, what you can do is that I had already said, decrease your carbohydrates and fat intake. Exercise daily, at least for 1 hour, even it may be slow walking or anything. Do something which is really good for your body, which can really kind of help the stored fats or carbs to dissolve. Okay, next one is increase your protein intake. This is one of the most important thing which you should be doing. And decrease your stress levels. Because of this also you may feel angry. Because of that you should decrease your stress level. You may saying, I'm having such a job which gives me so much of stress. Of course you are the one person who is taking the stress. Just sit down and meditate before you go for work. See the difference. You will be able to see the difference. Before you do something, you cannot say, this is not going to work. It's going to work and you should be doing that. That's all. Okay, these are the things. If you ask for homeopathic treatment for the acanthosis nigricans, as an homeopathic practitioner, I say that first you should change your lifestyle. Before you change your lifestyle, you just come and say, doctor, help me out. No, it's not going to happen, because medicines are going to help you for 60 to 70%, but your body should also encourage that. Means you're taking the medicine and you're taking the normal food, which you're taking fries, deep fried items and everything, and you're not taking a healthy meal. Of course it's not going to go away. So before that you should change your lifestyle. Okay, now note down the important homeopathic medicines which are really helpful in the treatment of acanthosis nigricans. First one is graphitis. Why graphitis? Because graphitis really kind of control the insulin level, and it also it is a very deep acting remedy on the skin, and it also kinds of fight against it, and it does not leave your skin to literally kind of get darker. Okay, next one is nitromu. Nitromu, why we give is because the person who is suffering with an very sedentary lifestyle, because I already said Sedentary lifestyle is one of the major cause for this acanthosis nigricans, or increase in the insulin levels. So neither mute people can really kind of have this sedentary lifestyle, and if they change it, everything goes into the normal. Next one is calcarea carb. Why calcarea carb is because they are obese and they are really kind of eating so much of fried items, and they are into the carbs. Because of that, calcarea carb has also act wonders in the obese patient who is short, very, and having this hyperpigmentation on the necks most probably. Next one is ferromet. Ferromet is given for the people who are suffering with anemia, and because of anemia they are eating unhygienic food because of this craving and everything. When this is being treated, of course the root cause is also being corrected. I think this was helpful. If you ask for any kind of homeopathic creams for the external use, you can just go for the Berberis Aqua Cream SPL, and you can also go for the Graphitis cream from the SPL only. But treat it internally, not externally. Thank you.